The large ulcers.
Yeah, damage to the intestinal lining,
A lot of
right?
diarrhea.
The epithelial cells. Right, we talked about those last chapter. Right?
Yes.
I don't know if it took all the white blood cells or just reduced the number of white blood.
Yeah, so destruction of the numbers of white blood cells, yes. So it did get rid of all the white blood cells. They had to transplant new stem cells in just to get them to start producing white blood cells again. Okay. Good. Anything else?
His skin started falling, right?
Yeah, shedding of the skin. Right? So all of these things are tissue reactions. And all of these things are threshold effects. They're not going to happen from just any amount of radiation. It takes a certain amount of radiation to cause this to happen. Right? So, if you see a graph like this, right, about radiation effects, first thing to do, check the corner.
Mm-hmm.
You check the corner, does the line start immediately?
No.
So here we do not see the line start immediately. That tells you this is threshold. If you see something coming straight out of the corner,
That's non.
that would be non-threshold, correct. So nothing's happening, right? Our dose is increasing, right? X-axis is dose. So dose is increasing, nothing is happening still. Only once we reach this threshold, this minimum limit, do we start to see stuff happen. So now as the dose increases, now we see more and more effects, more and more effects, more and more effects, until eventually it levels off, right? So y-axis is severity, right? How bad the effects are. X-axis is the dose. So as dose increases, the severity of the effects also increases. Right, so far so good?
Mm-hmm.
We're okay with threshold, non-threshold?
Mm-hmm.
Looking at this line, does this look like it's linear or non-linear?
Nine.
Non-linear, that's right, it's not a straight line.
Because line linear is a straight line.
Good job. Okay, so a lot of different things that can happen with these early tissue reactions. So, receive 6 grays, got a whole laundry list of things. Nausea, did we see this in the video?
Yes.
Yeah, we did, right?
Fatigue.
Grew up. Fatigue,
Mm-hmm.
okay.
Yep.
Erythema, right? So reddening of the skin.
Yep.
Epilation.
Yep.
What on earth is epilation?
Sweating.
Loss of hair.
Oh, my fault.
And my son, he lost it.
So we'll talk about that more later. Blood disorders.
Yes.
Yep,
Yes.
we saw that. Intestinal disorders.
Mm-hmm.
Yep. Fever. They didn't really
They
mention
didn't
this.
mention it.
Okay. Dry and moist desquamation.
Yes.
Yes.
What on earth is desquamation?
What he had.
So this one would be loss of skin, right? The shedding of
I know,
skin.
poor guy.
Right, and it was moist, right? It was
Mhm.
leaking fluid through his skin as well. Depressed sperm count,
Probably
they didn't
so.
mention anything, but probably so.
No, that was going.
Sterility, well, didn't have a chance to test it out, but probably so. Injury to the central nervous system, okay, we probably didn't have that much of this. Okay? This usually is on the higher end. Okay, so these sort of reactions all fall under the category of acute radiation syndrome, ARS, right? Acute meaning short term. Okay? So, these sort of effects are not a significant concern for X-ray. Because when you shoot a chest X-ray, you're not coming anywhere close to 6 gray. You're not coming close to 1 gray. Right? Chest X-rays are very, very, very low doses of radiation. So very few diagnostic procedures that we encounter can produce enough radiation dose to cause acute radiation syndrome. Right? Even CT with its high amount of dose, not going to be enough. You'd need something like a very long fluoro or IR case. Yes, Cody.
And for the 6 grays, like that could also be described as 6 sieverts, right?
Yes. So dealing with X-rays, yes, within 6 sieverts.
Within 6 grades would be from 1 to 6 also, sir?
So we'll talk about the ranges later. So right now I'm just saying that, we would, so up to 6 grays, you'll see these sort of things. You go over 6 grays, you'll see more nervous system stuff. But once again, you'll see the ranges in just a moment. Okay. But yeah, with X-ray, probably the most likely effects we're gonna see are skin effects, right? We're gonna see that erythema. So one of the doses that we look at is entrance skin exposure, ESE, right? And entrance skin exposure is calculated based off the DAP, the dose area product, right? Which is gonna be based off air kerma. Right? So all of this stuff comes back together. Okay, so skin exposure, DAP, air kerma. All right, so okay, right, short but severe. So these are things that can pop up within several hours to a few days. 4 stages, so we discussed these all the way back summer 1, prodromal, latent, manifest, recovery, or death. And then we have 3 dose-related conditions: hematopoietic syndrome, gastrointestinal syndrome, and cerebrovascular syndrome. Okay, as you can see, these focus on different body systems. So we will see how acute radiation syndrome affects these different body systems. Okay. So, prodromal phase or prodromal syndrome. So this occurs very soon after exposure to radiation. Okay. And the symptoms increase with increased dose. So, based on the video we saw earlier, what sort of effects did you see happening during this prodromal phase?
The reddening of the skin.
So,
Nausea.
that's
Diarrhea.
right.
Well, I don't know about
Nausea.
no diarrhea, but
Yes.
we don't know what.
Yes, so the main thing that they mentioned was nausea, right? Because immediately after exposure to the radiation, they all threw up, right? So that was prodromal.
It says occurs hours after whole body exposure.
What is that?
Your PowerPoint says occurs hours after whole
So
body
yes.
exposure.
So yes,
So
this
it's not
is very
immediately.
soon.
Is that,
So within hours. Okay? So within hours.
so the hours would be,
1, 2, 3, 4, 5.
So within hours. So if it happens 2 weeks later, that's not prodromal. But if it happens within the first hour, within the first 2 hours, within the first 3 hours, that's probably prodromal.
Okay.
Yes, John.
Is fatigue also part of prodrome?
It could be. So yeah, everything that we saw here, right? So some of this stuff is going to be more longer term, right? Blood disorders, intestinal disorders, like nausea, fatigue, erythema, right? Those are going to be prodromal. Fatigue can also be more longer term as well. Okay, after prodromal, we have the latent period. So during the latent period, right, this is when we don't really see these visible signs or symptoms of damage. So in the video, there was that one nurse who was like, oh yeah, he actually seems fine. He seems like he's gonna be healthy enough to go home soon, right? Because at that point, he was in the latent period. So it's like, outwardly, he looks fine aside from a bit of radiation burns, right? But it's what's happening inside that's gonna cause the issues down the line. Okay, so person appears healthy during the latent period, but within the body, there are changes happening that will lead to either recovery or death. Lasts about a week, right? Varies depending on the amount of dose. Okay, after the latent period, we have manifest illness, also called the onset phase. So this is when the full brunt of those issues really hits the patient. Right, so this is when he was in the bed and now he was bleeding and his skin was shedding and he was sweating and he was losing blood and his blood cell count was gone, right? That was manifest illness. Right? And as you saw, the manifest phase lasted until he either lived or died, right? Until either healed or he died, right? And unfortunately, in that case, he did end up dying after the manifest illness phase. So during manifest illness, this is when we're going to see our hematopoietic effect, our gastrointestinal effects, and our cerebrovascular effects. Okay. Finally, recovery or death. 2 to 3 grays is considered to be near lethal. Okay, could take up to 3 months for recovery. 6 to 10 grays considered to be highly lethal. And if you remember, Mr. Ochi received 17 grays, right? So way within that lethal range.
So he had like no chance. From the jump, he had like no chance.
It would have really taken a miracle, yes.
17 grades, that would have been a nice, gigantic type miracle.
Okay. Right. So, are we okay with the order of these phases in acute radiation syndrome?
Mm-hmm.
So, your key points here, make sure you know what happens during each phase, and make sure you know the order of your phases. Those are going to be the key things to know.
This is wrong.
Yes, Cody.
The
Hematopoietic?
what does that mean? Is that
Mm.
with the liver? Or-
Ah, very good question. So,
Hemo.
hematopoietic, right? So, hemato means blood.
Yeah.
Poietic is formation. So this is about the formation of blood, the production of blood, right? So we talked about last chapter how when our blood cells are exposed to radiation, it's not the active blood cells that are most affected. It is the stem cells, right? The precursor cells that create the blood cells that are affected. And so when those cells are damaged, that is part of the hematopoietic syndrome. Right, the effects on cells producing blood. Okay, so also known as bone marrow syndrome, because blood production happens in the bone marrow. So hematopoietic syndrome is going to be the one that is most common at lower doses. Right, so 1 to 10 grays, that is, so low doses, you're more likely to see effects of the hematopoietic syndrome. Okay. So, the stem cells for red blood cells, for white blood cells, for platelets, these are the cells affected by the hematopoietic syndrome. Okay. And when the stem cells are destroyed, then the production of the blood cells slows, or it stops. So the existing cells are fine. Eventually the existing cells are going to die off. And once the existing cells die off, then where are the new cells coming from, right? If there are no new cells being produced, that's when you see the drop in numbers of blood cells. So if you take a look at this graph over here, here we see different types of blood cells. Thrombocytes, hemoglobin to represent our red blood cells, neutrophils and lymphocytes, right? These are our white blood cells. So the x-axis here is time, right? As we travel from left to right, time is passing, right? We're going from our prodromal phase to the latent period to the manifest to the recovery. And so time is passing as we go from left to right. Okay, up and down, these are the numbers of cells. So as you can see, we've got tons of platelets inside the body, right? Red blood cells also have quite a few. Neutrophils, right? White blood cells, and then lymphocytes, not that many. Okay, but starting off, these are normal numbers. So 1 gray of radiation hits. What happens is we see red blood cells are pretty much unaffected. Why don't we really see a big change in the red blood cell count?
Is there more mature?
Right, so red blood cells are mature, there's a lot of them, but more importantly, if we lose the ability to produce red blood cells, how long does it take before we really see that effect? How long do red blood cells last?
5 days.
Like 120 days, right?
20 days, yeah.
So it's going to take a while to really see a big dip in our hemoglobin, just because even if we lose some of our stem cells that produce red blood cells, the existing ones are still fine. They're going to last a while. On the other hand, right, thrombocytes, we can see a dip. Neutrophils, we can see a dip. Lymphocytes are actually, they seem relatively unaffected here by our 1 gray. But what if we had 3 grays of exposure, right? So higher dose, more severe effects, right? That's what we said about these tissue reactions. Higher the dose, the bigger the effect. Now, 3 grays, thrombocytes, boom, their numbers crater, right? We drop down to almost 0. Neutrophils, numbers also drop significantly. Lymphocytes, it's basically a cliff, right? It's just boom, straight down. Why? Because these are our shortest living ones, right? These don't live for very long. So, all of these cells, we see a significant decrease in their counts. Hemoglobin, though, red blood cells, it drops a little bit, but it's relatively fine. So, when we talk about the loss of blood cells from the hematopoietic syndrome, we are really not talking about red blood cells. Right? I know we think about red blood cells as being the most important cell in the body, it carries oxygen to the cells in the body, right? That's an important component of the blood. But hematopoietic syndrome really is not about the red blood cells. It's about the white blood cells, it's about the platelets. Does that make sense? Yes, Cody.
So this term is only used in regards to like receiving a dosage of radiation, right?
Mm-hmm.
Like it wouldn't be, like if something happened to cause any of these to like decrease that wasn't from radiation, like that'd be termed like something else.
Right, so things like anemia or anything else that can cause a loss in white blood cells, like HIV and AIDS, right? Those would not be considered part of the hematopoietic syndrome.
Okay.
Okay, so some key things to know about the hematopoietic syndrome. 1, survival decreases with increased dose. Makes sense. The higher the dose, the fewer blood cells we have. Less white blood cells means more susceptibility to illness, less ability to clot, and so survival decreases. So, more likely to become infected because the white blood cells are gone, more likely to bleed out because the platelets are gone. Okay, at the low end, right, we're only going to see a reduction in the cells, but then they're going to come back. And that's what we discussed last chapter as well. And we're like, okay, 0.5 grays, we see a small dip in these blood cell populations, takes a couple weeks to recover. Okay. However, right, higher doses leads to more severe effects that can eventually lead to death. Now, like you saw in the video, if there is a medical system behind the patient, right, like we can extend the patient's survival rate thanks to supportive care. We can do bone marrow transplants and blood infusions or blood transfusions, right? And so that would help to extend the patient's survival rate. So one of the things we discussed last chapter as well was that when talking about lethal dose, we used to use 50-30 as our lethal dose. 50% of the population dies in 30 days. But we have extended that lethal dose to 50-60. 50% of the population dies in 60 days. Why the increased period of time? Because people are just surviving longer. So 50-30 doesn't really make sense as a descriptive factor anymore. And 50-60 better reflects the reality, thanks to medical care. And then over here, got a nice little picture about some treatments that they currently have for victims of acute radiation syndrome. Right? Hematopoietic ARS, they get some stem cells, right? Do some transplants, do some cell therapy, and hopefully we get recovery. Okay, so any questions about the hematopoietic syndrome? One more time, what kind of cells does this affect?
White, red, and platelets.
All right, so blood cells, primarily white blood cells and platelets. But is it the white blood cells and platelets that are affected? Or is it the cells before them?
Before.
Right, it's the cells before them, right? It's more of the stem cells. Right. So once again, right, we said when talking about cells and radiosensitivity, it's always the immature, the undifferentiated cells.
Oh, that's
right?
the law.
Rapidly dividing cells, right? The law of Burgundy and Trippendale.
Yeah.
Right? It's those cells, like the stem cells, that are most radiosensitive, most affected by radiation.
So stem cells.
Yes.
Okay.
The stem cells for the blood.
So for pneumatic cells, we won't say it's it's white blood cell and platelets, but we will say the stem cells of white blood cells and platelets.
Yes, that is the best way to describe hematopoietic syndrome. It affects the stem cells for white blood cells and platelets the most. Right? So remember, we said stem cells usually end in what kind of ending? Blast. Right? So our myeloblasts, our megakaryoblast, right? So those cells that end in blast, those are the ones affected here in hematopoietic syndrome. So far, so good? Yep. Jay.
So I just looked it up. It says through a jawbone, they discovered that Hiroshima, near like less than a mile away from the ground zero, was 9.6 grays or 9.8 grays.
9.6 grays 1 mile away from the center of Hiroshima.
So
That's a lot of grays, yes.
in less than microseconds, that like, and does it keep going? Like, does that radiation keep getting emitted?
So it depends. In the case of Hiroshima, because there was fallout, right? And fallout is just radioactive particles that remain. Then yes, those radioactive particles would continue to emit radiation. Right? So alpha particles, neutrons, and just regular gamma rays as well. All right. So, topic 2, gastrointestinal syndrome. If you had to guess, what body system are we talking about now?
The intestines.
Stomach and intestines, yes, exactly.
Feel it.
Right. So now we are moving away from our blood cells. We're looking at the stomach and intestines, right? Digestive tract. So for the gastrointestinal syndrome, we only see this at higher doses, right? Starting at around 6 to 10 grays. Right? So remember, right? Higher threshold. So if I ask you a question that said, which of these is most likely to occur at 2 grays? And your choices were hematopoietic and gastrointestinal. What would your answer be? Hematopoietic, right? 2 grays is high enough for hematopoietic, but too low to see gastrointestinal. Right? That is our threshold. Here is our threshold. So, those 6 to 10 grays over the body, we see gastrointestinal syndrome, usually leads to death within 3 to 10 days. Of course, with support, the patient can last longer. In this case, survival time does not really change with increased dose. Once it hits, it just hits. So, in the case of gastrointestinal syndrome, the prodromal stage can last for up to a day, right? So from exposure up to 1 day. And this is when we see nausea, vomiting, diarrhea. And so sort of the things we saw in the video as well. And then the latent period afterwards usually lasts up to 5 days or so. Okay. And then after the latent period comes the manifest stage. And that's when we get severe nausea, vomiting, diarrhea, fatigue, loss of appetite, lethargy, hemorrhage, infection, electrolyte imbalance, and a whole bunch of other things. So, initial response, nothing appears to be wrong, and then all the wrong stuff happens. Right? So once again, this is ARS, right? The stages of acute radiation syndrome. Yes.
So from
Shakib.
latent period, it just becomes silent. Nothing is happening then.
Right. It's silent, looks like the patient is healing, and then all the other stuff starts happening. Okay. So we talk about gastrointestinal syndrome. What we're most going to be focused on are the epithelial cells. epithelial cells lining the GI tract. Right? Epithelial cells, they are rapidly dividing, and so they are radiosensitive. So we saw that again during our previous chapter. Okay, so small intestine, large intestine, stomach, right? These are going to be affected by the gastrointestinal syndrome, by the death of epithelial cells. Small intestine is going to be the most affected part out of all of these. When the intestine is infected, when the intestines are affected, we run into infection, dehydration, and diarrhea. So, right, epithelial cells die, they can't produce new cells because the stem cells have died off, and so the lining wears away. And then as we saw in the video, right, when the lining wore away, it caused bleeding, it caused diarrhea, it could also cause sepsis, right, infection of the bloodstream. All right, so any questions about gastrointestinal? So we're comfortable with the idea that hematopoietic can happen first, gastrointestinal requires more dose, right? And so after that, the one that requires the highest dose to show up is cerebrovascular. This typically requires a whole body dose of 50 grays in order to occur. Right? So usually you're not going to see effects like in terms of brain damage or anything from radiation. Right? Usually it's going to be about the blood or it's going to be about the gastrointestinal tract, the GI tract. Right? Rarely do you see radiation damage affecting the brain and the nerves like this because you just need such a high dose for this to occur. Yes, Jay?
So then if a person were to receive this much radiation, they're like already going through the other steps that we talked about?
So yes, they would go through all three at the same
Right.
time. So it's not going to be a 1, 2, 3 thing. Everything's happening at once. But if a patient is receiving this much dose, they are pretty much going to die within a few days. Okay. Because sure, cerebrovascular syndrome is happening, but just like Jay mentioned, right? Hematopoietic gastrointestinal syndrome is also happening, and those are hitting really hard as well, right? Loss of blood cells, bleeding, vomiting, diarrhea, sepsis, right? And so, oftentimes, the patient dies from this stuff before we even really see the effects of cerebrovascular syndrome. So, based on the name, cerebrovascular, right, we're talking about the nervous system, we're talking about the cardiovascular system, right, so brain, heart, nerves. And so we find that, okay, radiation damage to blood vessels can cause fluid to build up inside the head. Okay? And if we have increased fluid inside the head, there's increased pressure in the head, that fluid pressure pushes on the brain, and it can cause brain damage. Okay? And then that can eventually lead to death. So, with such a high amount of radiation, we find that in the prodromal stage, that very initial first stage, we see excessive nervousness, confusion, nausea, vomiting, diarrhea. Okay? These seem pretty familiar. Loss of vision, burning sensation of the skin, loss of consciousness. Okay? Once again, latent period, up to 5 days. And then as far as manifest, disorientation and shock, agitation and stupor, ataxia. So ataxia is just a lack of coordination. Edema, loss of equilibrium, fatigue, lethargy, seizures, meningitis, right? All sorts of things can happen. But once again, it's a lot more rare to see the manifest stage of cerebrovascular syndrome. Yes?
So when they're treating the patients and stuff, do they have to wear radiation protection or?
Good question. So it depends on if the patient is contaminated or not. Right? Because, like we've learned, when you shoot X-rays and the X-rays pass through a patient for a chest X-ray, it's not like you've turned the patient radioactive. Right? The patient is not going to start glowing in the dark or anything. So the only reason a patient would be giving off radiation is because they themselves have been contaminated by radiation. So now they have something in their body that is producing radiation. So it could be that they breathe in radioactive dust, right? Or in just a medical setting, when patients go through nuke med and receive those isotopes into their blood, right? That makes them radioactive for a while, right? Because now they actually have radioactive particles in them that are actively giving off radiation. So depending on what exactly happened with the patient, hazmat or that kind of radiation protection may or may not be required.
And they would eventually like not be radioactive at one point, right? Because it's just gonna, because of the decay.
Right, so you'll have decay, you have half-life, although usually depending on the material, half-life can be really short or really long. And then the body, right, filters out and tries to excrete some of those substances as well. So, any questions on cerebral vascular syndrome? This time, not too much about cerebral vascular, since once again, it only really occurs at super high doses. So one, know that this is at super high doses. And then two, like if you see anything related to the brain or function, right, like confusion, right, agitation, loss of coordination, right, just associate those with cerebral vascular syndrome. Yes, Cody?
Do you think this is something that they discovered by like testing in the lab, or do you think this was because of like
Great question.
like, someone was actually exposed?
Yes. So the majority of our knowledge on this subject comes from the atomic bombings and from Chernobyl.
Okay.
Right? So thankfully the medical community has enough restraint to not just go and expose people to radiation to see what happens. Okay, they do have some morals.
But they used.
Not gonna go there. Depends on who, what, when, where. So yes, the majority of our knowledge comes from nuclear accidents. So I guess Fukushima, our most recent nuclear accident, we would have taken that data and then incorporated into our knowledge as well. All right. In that case, 1 o'clock, let's take a break.
Thank you.
All right, 10-minute break. Please be back at 1:10. Please be back at 1:10.